even as experts, when we look at burn wounds, we're wrong 30% of the time in the first 24, 48 hours of the depth of those injuries. So we suggest that any parent that's looking at a burn wound that's taking too long to heal, they should get medical attention. And what we mean by too long is any wound that is taking longer than 10 days to 2 weeks to heal, that requires a referral, because often there can be more damage or there's a higher chance of scarring.
In a minor burn, a couple signs to look for to ensure that the burn is actually healed is that the surface of the skin will look drier. If it's still an open wound, still with the skin healing, it might look a little bit shiny, a little bit wet. But once that wound has healed, as wounds do heal from the outside in, and the wound will get smaller and smaller, it will have maybe a dry, flaky appearance, as newly healed skin can be sensitive and actually drier than the rest of your skin. It will still have a red appearance, and the change in color might actually remain for about a year post-injury, but this red color will fade. But in the meantime, you can keep that area well moisturized. Some children will actually say that they're itchy in that area that's newly healed, and the best thing to do is just moisturize it twice a day, and you can even do it 3 times a day if your child states that they're still itchy with twice a day.
And the 10-day to 2-week rule it applies to wounds of all sizes. So even small areas that are not healing, that they can be in some difficult or specialized areas, such as the hands and the feet, as I've mentioned before. Those are the ones that we really want to make sure are appropriately referred in an appropriate time.
It's very important to avoid direct sun exposure, as this can change the color of the skin. Newly healed burns, they will appear red, and this redness will fade over time. Although during that time period, which can last up to a year post-burn injury, it's very important to protect that skin. If it's skin on the face, it's important to wear a wide-brimmed sun hat and reapply SPF of 30 to 50 fairly frequently. We do encourage parents to take their children out, bring them to the park, bring them to the pool, but just keep them covered in some sun protective clothing, bathing suits with long sleeves if they did sustain a burn on their arm, and if it is an area where they can't have it covered, such as their hands, just reapply a sunscreen frequently, maybe every 1 to 2 hours. And we highly encourage them to go swimming in salt water and chlorinated pools, which is very important to rinse them off once they come out of the water, as this can contribute to the dryness of their skin, and reapply an SPF so to re-moisturize their skin once they're out.
We know that the outcome from a burn injury, which can be permanent in terms of scarring and a continuous reminder, that it is not based on the size of the injury. So even relatively small injuries under bad circumstances can be a permanent reminder and have permanent effects. And the contrary part is that even larger injuries, which can be accidental and can happen, that the outcome you would assume with the larger injury would be worse, but it's not true in this area. Which is why when we talk about minor burn injuries, we're very careful to say the word minor implies that it doesn't require a lot of treatment. When in fact, we know that even small, relatively deep burns, such as, say, the entire palm of my hand of a child that's touched a glass-fronted fireplace, will be the reminder and the presence of a burn injury for a long time.